Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 301 of the Ask Dr. Angela podcast. So this is really funny. I just got off the phone with a woman from Top Doctors Awards, and I've been back and forth with these people for years because they keep calling me, leaving me these messages, saying, Dr. Angela, you have received this Top Doctors Award, and this has been for like maybe 3 years running or so. And so finally, I decided, just call them back. And so I called them back and I was like, okay, look, can you please stop calling me because I'm not interested in purchasing anything. A lot of these are like solicitations for money. I'm like, I'm just not interested. So just stop calling me about this. And so she started cracking up and she's like, no, Dr. Angela, this is like really legit. And so she ended up sending me the website, and patients and colleagues actually nominate you to be a top doctor because of clinical expertise, etc. And so this is, I feel like, so ridiculous. Turns out for like the past 3 years, I've been nominated as a top doctor in my field. And so finally I said, well, hell yeah. I am going to get the plaque that acknowledges me based on the recommendation of patients and colleagues. It's such a huge honor. And so, I guess, maybe I'll have to get plaques commemorating this for the past 3 years, just FYI. But I thought it was just really, really, really funny. So as soon as I get it, I'll make sure that I share it. I'll post it on like my social media. But such a huge honor to be recognized for excellence by your colleagues. I'm a bit humbled. So today's topic is postpartum recovery. What to expect postpartum. And certainly a lot of that has to do with the type of delivery that you had. Was it a vaginal delivery? Was it a C-section? I personally had a C-section, but I went home on the same amount of days that a typical vaginal delivery does. But that's like a whole nother story. I don't like to be in the hospital. Anyway, regarding a vaginal delivery, the day of delivery is always considered day 0. For vaginal deliveries, as long as they're uncomplicated, and by uncomplicated, I mean you didn't have any significant blood loss, there were no significant vaginal or perineal repairs, you don't have any significant issues with blood pressure, blood sugar control, etc. As long as your postpartum course is unremarkable, i.e., you're doing great, you're moving around, you're eating, not bleeding exceedingly, your vital signs are stable, as long as all is well, most moms status post-vaginal delivery go home on postpartum day number 2. Remember I said to you, postpartum day 0 is the day that you actually deliver. And some moms that are multiples, i.e. it's not your first baby, you're trying to get home to the kids, as long as everything was unremarkable, you're doing well, baby's doing well, sometimes we'll let you go home on postpartum day number 1. But usually it's postpartum day number 2. Now, if you were a C-section, like I had a C-section, usually you go home postpartum, or I'm going to say post-operative day number 3. Post-op day number 0 is the actual day of your C-section. So usually for uncomplicated routine C-sections, you're going to go home on post-op day number 3. Usually things that you will be required to do prior to going home from a C-section is you have to be up and moving around, you have to have good pain control, minimal bleeding, your incision has to look great, vital signs are stable, lab work is stable, there are no complicating factors, as with a vaginal delivery. No poorly controlled blood pressures, blood sugars are good if you happen to be diabetic, etc. The big thing status post a C-section is just making sure that you've gone over incisional care with your physician. That's really important. And my general rule of thumb for C-sections is you should not be lifting anything heavier than your baby, at least for up to 8 weeks. Some people say 6 weeks, but I like to do up to 8 weeks because, contrary to popular belief, C-sections are major surgeries and we heal from the inside out. And so you want to give your body every opportunity to heal adequately. The nice thing about postpartum courses now is that we see you a lot sooner than we used to. Back in the day, we used to just, discharge you from the hospital hospital and say, oh, we'll see you back in 6 weeks. Not anymore. We're now seeing patients back routinely in 2 weeks for an early postpartum evaluation. And that's just to make sure that, if there were other conditions that complicated the pregnancy, like diabetes, thyroid issues, blood pressure issues, that we bring you back to make sure that those things are under control. And also to make sure that moms are adjusting to life postpartum, to make sure that moms socially are adjusting, to make sure that they have adequate support, to make sure that they are not, suffering or dealing with things like postpartum depression. One of the reasons that I like the 2-week visit, which we are now implementing, is that it allows us to get ahead of postpartum depression before moms sink too deeply into it. Postpartum depression is a really big deal, and I'm really happy that we're now starting to give it the attention that it deserves. So usually at that 2-week visit, and everybody comes back for that 2-week visit, whether you're a vaginal delivery, a C-section, usually at that visit, we just, again, make sure that everything is going okay. If you are someone that is having issues with, sugar control or with blood pressure issues, we may even bring you back a week after delivery to touch base and make sure that everything is okay. At your postpartum visits, we address any and all questions or concerns. Sometimes breastfeeding issues come into play. The birth control topic typically isn't addressed until your 6-week visit, because it's at that point that you typically will initiate something for birth control if you're considering it at all. The other thing is we usually do recommend pelvic rest, nothing per vagina, until at least 6 weeks, and sometimes longer than 6 weeks, depending on how significant the delivery was or how significant the repair was, because you really want to give the vagina an adequate amount of time to heal. So postpartum recovery is individual. Everyone's different. For me, as I previously stated, I actually went home on post-op day number 2 from my C-section. I would have gone home on post-op day number 1, but my colleague and partner would not discharge me. I just don't like being in the hospital as a patient, in case you didn't notice that. But this is a topic that I cover extensively in my pregnancy book, Ask Dr. Angela What to Expect During Pregnancy and Beyond. I cover so many common and hot topics in this book. It's available on Amazon in both an ebook and print version. I really would love for you all to pick this book up. It's short, concise, to the point, and really easy to read, really easy to understand, really relatable. I talk about a lot of my own experience as a pregnant woman. Pregnancy certainly gave me a whole new perspective on pregnancy, and it really allowed me to be able to better take care of my patients, because it allowed me to be empathetic, not sympathetic, but empathetic, actually knowing what moms go through, because why? I went through it myself. So I really urge you all to check that out and let me know what you think. I would love, love, love your feedback. If you happen to have a topic, question, or something that you want addressed on the podcast, you know how to reach me, www.askdrangela.com. That's AskDrangela.com. You can send me an email. You can direct message me on any of my social media venues. That's Twitter, Facebook, Instagram. Y'all know how to reach me. Y'all know how we do it. So in closing, I'm going to leave you with another one of my favorite quotations from the Congratulations Graduate book. I'm telling you, I'm sure that I did. I'm actually looking at it right now. I got this book when I graduated from high school. It's crazy, but it's still a book that I look to and that I love. And so today's inspirational quote says, "First thing every morning before you arise, say out loud, 'I believe,' 3 times. I love this quote. It reminds me so much of one of my favorite movies, The Wizard of Oz and Dorothy, and just believing, because it's in you all the time, all along. It's in you. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 302 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.